the first two muscles that we're going to test are hip flexors, and so the full active range of motion is going to be the same for both. So Stephanie, what I'd like you to do is bring your right knee to your chest. Great, come on back, that was great, thank you. Now, we have someone in class, but you also have patients who don't want to lay flat like this. You can go ahead and put something to support the opposite knee while you're testing this leg if laying flat is bad. Okay? So the first one we're going to test is iliopsoas. Now, interestingly, for iliopsoas and rectus femoris, the starting position is exactly the same. Okay? So we're going to be slightly abducted. You're going to go up into flexion. But for the iliopsoas, we're going to be laterally rotated. And for the, I said rectus femoris before, I think. I meant the TFL. We're going to be rotated in. Okay? So iliopsoas out. TFL, thank you. We almost said it again. In. But otherwise the test is exactly the same. Okay? And the full active range of motion is the knee to chest. Okay? So what I'd like you to do is I'm going to have you roll your leg out again for me a little bit, and I'd like you to lift it up off the table. There you go. Yeah. Sorry. That's good. Okay. Now I want you to hold it there and don't let me push it down. Okay? And release. Okay? Now, for TFL, we're going to do the same thing, but now I'm going to have you roll your foot in, and I want you to come up in the same, yeah, good. All right? Now hold it there, don't let me push it down.
Are you applying pressure with both of your hands? Then?
Yes, yep.
Are you going at an angle?
Yes. And release. Okay? So I'm applying, I don't like applying all my resistance at the ankle because I'm crossing the knee. I'm not strong enough to put all my resistance with this short of a lever arm. Because Stephanie's going to win and I don't like that. Right? So I'm applying pretty equal resistance here so that I'm not putting stress on the knee, but I have the advantage of a longer lever arm. Okay?
So for that one, your pressure, you're trying to put her into extension and adduction?
Correct. Correct.
For both?
Yep.
So as in.
So we're not resisting the rotation component, but we're using the rotation of the leg to try to differentiate between those two muscle groups. Okay? Now, the next one is going to be the sartorius, which is a goofy one. Okay? Now, how we used to do it in the olden days is we would have someone rub their heel across their opposite shin. It ends up that that doesn't activate sartorius at all. Okay? So you may still see that in the clinic because that's how we were all taught how to do it, and that's just not the right way to do it. So this one, this is the instruction I give people. What I want you to do is put your leg into a frog leg position, okay, which will be awesome in a skirt. Yes. So you're going to come up like that. Okay? So I'm going to bring you up a little bit there. And go ahead and come back down. So what I'm going to be doing is I'm going to be pushing your top of your leg down, and I'm actually going to be pushing the bottom of your leg out. But I want you to try to keep your leg in that position, okay? So I'm going to be resisting the flexion part of the sartorius with my top hand. And then the sartorius is also a lateral rotator. So what I'm doing with my bottom hand at the ankle is pushing her into medial rotation. Okay? So come on up for me. Give me a good old frog leg. Good. I'm going to put you there. Okay? Ready? Hold it there. And relax. Okay? So I'm pushing down with this one and pulling her into medial rotation with the other. Okay? Alright, so we've already done the hip rotators. Okay, so I'm going to have you face, I need you to lie on your side, I don't care what side you face. Maybe face me. Be kind of weird behind you. So this one, we're testing the muscles on the inside of your thigh called your adductors. So what I'm going to do is I'm actually going to hold your top leg up to give you some room. And then what I'm going to ask you to do is to take that bottom leg and lift it up off the table. Okay? Right. And then you'll come down and then I'll have you go back up as high as you can, up to your other leg, and then I'm going to try to push you down on the table. Okay? Now this one is goofy because your legs aren't going to be touching the table, so feel free to use your hand to stabilize yourself there. But what I don't want you to do is use your trunk muscles to resist me. I really want to just test those muscles of your leg. Okay? Alright. Let's go ahead and relax this leg. Let me take it. You're going to have enough to do with this one. Okay, we're up, so go ahead and lift this leg up. Good. and then go back down. All right, so that's my full active range of motion against gravity. Pull it up again. Hold it there, don't let me push it down. And relax. Okay, go ahead and relax. Now this one takes a lot of core strength, right? Because you're really not very stable. And that's why I gave her the instruction to use her hand in front of her. But I'm watching her body as I'm applying that resistance to see if this is a core issue or a hip adductor issue. Okay? Someone had their hand up over there. Trina?
So would there be a gravity eliminating position?
Sure. So,
Your back.
yeah. Let's go ahead and lie on your back. So I'm flipping legs now, just for ease. So I'm going to bring this leg over. What I want you to do is bring that leg towards me. Great. And come on back. I would not have her shoe on.
Okay.
To decrease her friction.
Yeah.
In the gravity eliminated position. But I don't need to assist her leg because she's now gravity eliminated. If she can do that, I would have her come back to mid-range. Now I'm going to try to push her leg out. Don't let me. Okay? All right, so those are the adductors. Okay, so then I'm going to have you go back on your side. Now we're going to test the muscles on the outside of your leg. So your bottom leg you can now bend for me. So that it just makes you a little bit more stable. Okay, so we're going to test two different muscles that are on the side of your hip that are actually really important for walking. So the first one I'm going to have you do is, first I want you to just bring your leg up off the table as far as you can. Hold on a second. I want you to keep the side of your foot parallel to the floor. So don't point your toe for this one, just come straight up. Okay, good, and come back down. Great, range of motion. That is my full active range of motion against gravity for both my glute med and my glute min. Okay, now for both of these tests, it's really important. I like to stand in front of the patient so that I can talk to her and see her face. You can also do these from behind depending on, I have the advantage that I've got these long beasts, right? So I can reach over and take her into extension. If your arms aren't quite as long, you may need to stand behind. Okay? So what I'm going to do is I'm going to bring your leg back just a little bit. There you go. It's really important that she be in slight extension for these. Okay? Now, keeping your foot parallel to the table, go ahead and bring your leg back up. And hold it there. Good. Now don't let me push it down. Okay. Hold on. I need to bring you back a little bit more. There you go. Hold it there. Can you hold it there? And relax. Now, when she first resisted, partially because I'm in front of her, she immediately kicked in her hip flexors because that's going to be stronger. Okay? So then I had to cue her that I needed to take her back to make sure she was in slight extension. Part of it was because I stood in front. Okay, so you need to be watching for that. The glute med is going to be the same test, except now we're going to point the toe towards the ceiling. You need to make sure that she doesn't rotate her body back. Okay, so just rotate the toe and not the trunk. Come on up. You're going to be right there. Can you hold it there? No, Stephanie's so strong that I don't have enough leverage here to push above her knee. I didn't like how it felt. Go ahead and relax. I didn't like how it felt to be pushing at her ankle. Okay, but for these, you have to be monitoring the pelvis to know what she's doing here. All right. Now we talked about compensations for the hip abductors when we were doing this, when we were looking at the spine. So if she has weak internal and external obliques, she may not be able to actively abduct her leg against gravity. Right? So what's going to happen if her obliques are weak when I ask her to do that active range of motion?
Her leg will stay on the table and her pelvis will rotate.
Exactly. So her pelvis is going to depress on this side because these muscles are contracting, but these can't stabilize. Okay? So you need to be monitoring the pelvis to know if that's what's happening. And so that's what you're looking for there too. Because if that happens, if her obliques aren't strong enough, then I need to provide that stability and then see if she can lift up. Okay? So just remember, we covered that in the last section, but that definitely applies here. All right. Okay, we'll do glute max. On your stomach, please. So we're going to create active insufficiency of the hamstrings, which is a 2-joint hip extensor, by flexing the knee. Okay? Yep. And then what I want you to do is lift your leg up off the table. Good, and come on back down. And let's have you not flex quite that far. There you go. Okay, come on back up again. Now what you do is hold it there and don't let me push you down. And your knees. Good. Now what you'll see is I was going up on my tiptoes so that I could lock my arm. Because my puny arm is not going to compete very well with her glute max. Okay? So for some of you, you may want to actually get on a stool and lock your arm. And then you can use your body weight to provide that resistance. Okay? Now there's this goofy, I'm gonna have you stand up, Stephanie. Emma, if I kick you off the table, I think that'd be our best bet, sorry. Just so that we've got room here, and I'm gonna come towards you. So, am I making you nervous?
Yes.
You're gonna come over here, and what I'm gonna have you do is go on the table on your elbows, like this. Okay? There you go. And rest your pelvis right up against the table. There, yeah. And we're gonna test your right leg, so with your left leg, I want you to move your foot forward a little bit and bend your knee. There you go. And then rest yourself there. Yeah, that's a little bit weird. Yep. Okay. So what I'm gonna have you do is that left leg is gonna hold you up. So put it where you need to have it, because I'm not gonna catch you. And then what I want you to do with your right leg is you're gonna bend your knee again, and I want you to lift it up. Yeah, just like that. Okay, come on back down. That time you brought your knee out just a little bit. I want you to try to bring it back as straight as possible. Yeah, that's good. Okay. So come on back up again. Hold it there, don't let me push it down. And relax. Okay, so the only reason you would do this modified position is if the person had tight hip flexors and didn't have any available extension. You're putting them in a relatively hip flexed position and still able to test the glutes against gravity. Okay? And I've had to use this test. But it's awkward. It feels awkward for the patient. But it is a test you'll have to use in the clinic because Americans in general have tight hip flexors. Okay? All right, so that's all of our manual muscle tests.